A very good morning to all of you. It's indeed my pleasure to be here in this very, very wonderful, bold conference which we have organized, which discusses all about sexual responses and about the sexual problems which are so rampant and need to be discussed very. So today I am going to speak on the sexual response cycle and mainly concentrating on female. So talking about sex, doctors, patients, non-judgmental understanding approach, start with general inquiries, acknowledge that it's a difficult task, encourage the person to talk about sex and no assumptions. So when we get patients, this is how we try to follow and try to get the myths removed. And the myth is that sex is intercourse. No. A man should be the sexual leader. No. And women should always not initiate sex. No. Respectable people should not enjoy sex too much and should not masturbate. No. And if sex is not good, something is wrong in the relationship. Again, these are the myths and these have to be sorted out first. So let's talk about what is human sexual response cycle. Now, there are basically 4 phases, but I have tried to divide it into 5 phases so that we can understand better. The excitement phase, the plateau phase, the orgasm phase, and the resolution phase. So desire phase or the excitement phase, desire. Now, in this phase, the woman emotionally wants to have sex, and the desire may start much before the formal physical foreplay. So she feels wanted, she gets the right environment, and it has to be a romantic dinner thing, sex texting. The desire gets heightened, and then she feels rushed into physical sex. Now, it may cause inhibition of desire and rejection of the male partner, not leading to subsequent physical. So women do need certain love and affection before they jump into the sex. So stage 1 is desire. Now, this is characterized by sexual fantasies, desire to have sex, reflects the person's attitude towards sex, motivation is needed, drive and personality is needed, and then finally the biological drive takes over. So what changes are going to happen? You feel palpitations, increased heart rate, increased respiratory rate, you're feeling like talking too much, increased blood supply to all the organs, skin, vagina, breast, so causes blushing, erection of nipples in the breast, increased lubrication of the vaginal walls, causing feeling of wetness in the vagina. These are all normal things which will have in the desire. Now, this phase prepares the woman for a sexual vaginal intercourse. So vaginal walls begin to produce lubricant liquid, and then it goes into the second phase. So a good stage 1 is that you've had a previous good experience with sex, the partner is available, good overall relationship with the partner, adequate self-esteem, ability to accept oneself as a sexual person and not inhibit that I'm an asexual person. There are problems here. So with this, we will discuss one problem also at each stage, so it will be better to understand. The hypoactive sexual desire may be there in someone because they have a deficiency of fantasizing or a desire. And this is more seen in female than male, 40% to 30%. Men also have about 30% of no desire or hypodesire. Frequency of sex, not important. Lack of desire is distressful. Then chronic stress, anxiety, depression, abstinence of sex for a longer time, deteriorating physical relationship would lead into a hypoactive sexual desire. So the desire disorders might occur in 40% of females, 30% of male, or maybe men, maybe 20%. But there is no definition of it. It's usually can be said as called as desire discrepancy rather than no desire. And this needs to be overcome because these couple have to talk to each other and talk to the psychologist and the counselor. So they have to verbalize their sexual needs. And desire in women is highly responsible. Women, are highly responsible to visual, to love talks, to gentleness, and to touch rather than go straight for an intercourse. So that has to be kept in mind here. So the common causes of low sexual desire in women is she has been rejected, there's no emotional content, there are some health issues, there are some stressors like parents, work pressure, medicines, hypertensives, antidepressants, etc., views about masturbation, views about sexual variations, anxiety about that her vagina is lax, her body image is poor, she's obese, she's very thin, worries about she'll not be able to please the partner. Depression could release norepinephrine, which causes narrowing of blood vessels and lack of lubrications and arousal. And that, so in short, do not feel like having sex. So that is what it is. And the desire disorders can be all over the body. It could be problems from head to toe, to adipose tissue, to pain, to body ache, to cardiovascular system, to oxytocin release, GnRH. So physical, psychological, social, everything would lead to desire disorders. Then we come to the second stage. Second stage is what we call as the arousal or the excitement. So desire and excitement, then the excitement and arousal. Now here is a cycle. This is a part of the desire stage only. Emotional intimacy motivates the sexual woman, sexual stimuli by touch and all, sexual arousal, arousal of the desire, and then emotional and physical satisfaction, and it forms a good, nice cycle of this phase. So this is a subjective sense of pleasure, which accompanies with a lot of physiological changes, penile erection, nipples, both the sexes get erect, increased blood circulation in the vagina, voluntary contraction of a large group of muscles, heart rate is increased, respiration is increased, blood pressure rises, and this stage will last from 30 seconds to 30 minutes also, the excitement phase. And in this, the male and the female arousal is that the blood flow to the sexual organs increases, and there is a sexual erection of the penis, erection of the clitoral region, and then swelling of the vulval vaginal part. And it all starts in the brain, where the emotional response to arousal arises. And this phase may take a longer time in female to get aroused rather than male. So females may have arousal disorders also, or what we call as female orgasm arousal disorders. Versus she's unable to maintain or attain lubrication and swelling and excitement. About 60% of the females may feel that. And during the sexual activity, they feel discomfort, pain, and roughness. Dyspareunia, that is pain. And there is a lot of dyspareunia risk factors, from age to proper hygiene to lubrication to medical conditions. And the signs of dyspareunia are the severe pain, entry dyspareunia, deep dyspareunia. And this will occur in about 15% of females, and 8% of men also feel pain. And organic infections, psychological stress, all this could lead to dyspareunia. Then women may also have vaginismus. This is involuntary contraction of the outer third of the vagina, so that the interferes with the penile insertion and intercourse. Now, this happens in very educated women, women who've had sexual trauma, women who have strict religious upbringing, and women who've had a very battered relationship through rapes, etc. So there are multiple drugs for female arousal. There could be oral drugs, physical, there has to be counseling, there has to be gradual use of dilators, and some of the drugs which vasodilate may cause post-sexual headaches and all also. Then we come to the third stage. The third stage is called as the plateau stage. So this is the third phase of the cycle. Here you can see here in the red and blue, it has been arousal, and then the plateau happens. And here the heart rate, breathing, pressure continues to increase. Muscle tension increases because of the lower limb. Vagina continues to swell, increased blood flow. The color of the vagina changes from dark purple. Lubrication increases. Women's vaginal clitoris become very, very highly sensitive to it in plateau stage. And if the plateau stage is attained properly, immediately the next stage would come in the woman and in the men is the orgasmic stage. And in the orgasmic stage, the cerebral response, it is possible to achieve orgasm without even vaginal or clitoral insertion. So it is mainly between the ears rather than in between the legs. And this has been seen in genital mutilated women. So orgasm starts in the uterus. Even infants can achieve orgasms, but ejaculation occurs only after puberty. And ejaculation occurs in women as vaginal contractions, releasing a little bit of that fluid outside, and in men as the ejaculation of the semen. So orgasm or stage 4 is peaking of sexual response, release of sexual tension, rhythmic contraction of perineal muscles and pelvic reproductive organs, emission of semen in men, and a little bit of discharge in female. And it lasts from only 3 to 25 seconds. So it's not hours of orgasm, which we feel that can be. And you can see the blissful feeling on the face, which will happen. In males, it is the first stage where there's contraction, and in the second stage, the contraction increases in throbbing manner, highly pleasurable feeling, and the release of the semen. Now, women may have female orgasmic disorders again. So women inability to achieve orgasm by either masturbation or coitus, or 35% would have this defect. And the presentation is that they have lower abdominal pain, itching, discharge, irritability, fatigue. It may be lifelong, it may be acquired, it may be situational. There'll be a psychological fear of pregnancy and a hostility toward men that they are damaging the vagina and a guilt. And there will be masturbation and G-spot stimulation. So that could be there. So this is how we identify where the G-spot is. And the woman, gently the finger is slid on the anterior vaginal wall, and where she says she has some feeling, which is about 1.5 2 centimeters away from the urethral anteriorly, is the G-spot or the crater. And this was described because this area is rich in vessels and nerves. So this has been described as a heightened area of pleasure. So orgasmic disorders can be early orgasmic response, delayed response, no orgasm or absent response, impaired response, that means the incident. And the causes are usually psychological, anxiety, inability to relax, medical problems like diabetes, Parkinsonism, multiple sclerosis, chemotherapies, pelvic traumas, hormonal imbalances, hysterectomies, spinal cord injuries, childbirth traumas, vulvodynia, cardiovascular disease, all that. And an orgasm, sexual disorder, where either or the partner fails to achieve orgasm during the course. And or it can be delayed ejaculation in men. So sex therapies. Now here there are a lot of medical treatments, and there are a lot of treatment with energy-based devices and things like that. So women who have laxity problem, we can use the lasers. And here what I'm using is a CO2 laser for vaginal relaxation syndrome and for heightening it. And after doing the laser, we can put in PRP in that area. So the collagen, neocollagenesis occurs more. Or we can inject PRP, as you can see in the other video. And this I'm doing it at the G spot and at the O spot. The graphium, and it's known as the G shot or the O shots. And the PRP is prepared within 15 minutes of activated PRP, it should be injected. Otherwise, what happens is that the growth factors or the platelet-derived growth factors will get. So now these growth factors, when injected into these areas which are vascular or nervous, the collagen increases and the vascularity increases and the sensitivity increases. But remember, they cannot take care of the psychological part. So broken relationship, psychological counseling, all is needed. Last phase is the resolution phase. Now, the resolution phase, you can see the facial bliss. The swollen parts come back to normal size. General sense of well-being is there. Love and greater intimacy is there. As you can see here, spooning. And if the position is spooning here, then it gives more intimacy. Women are capable of multiple orgasms, so they could demand for an orgasm immediately, but men have a refractory phase and they cannot get an erection until about 35 to maybe 1 hour or 2 hours. Lastly, in this resolution phase is a sense of total relaxation and disengagement of the blood from the genitalia, and no orgasm or resolution for the next 2 to 6 hours in men. But in women, they can have multiple and go for immediately. Some people will feel a severe postcoital headache or dysmorphia. Now here, this can be overcome by just taking NSAIDs and taking rest. Looking at all this, now let's briefly describe what is sexual dysfunction. inability to participate in the activity, sexual dysfunction, all occasions, maybe 6 months, maybe intermittent, significant stress. We've tried to tell you this with each of the phases, but dragons. Here you need to investigate them for everything, for local systemic diseases, blood sugar, infections, constipations, prolactin, thyroids. They should be properly investigated, and the phases should be worked out with them. Desire, excitement, plateau, orgasm, resolution. All the 5 stages should be worked out, so you know where the problem is and how to solve it. The treatment is dual sex therapies, imagery, and calling both of them to examine each in front of each other and explaining to them what is there and dealing with all the misconception. And telling them or describing foreplay, which is as enjoyable as the actual intercourse. And then you can put them on heightened sensory activity exercises. So the stage 1 is only touching, stage 2, touching the genitals, stage 3, mutual touching, stage 4, women on top. And then tell them to do yoga exercises, pelvic strengthening exercises, pelvic floor exercises, or to use the Kegel meter, Kegel exercises to massage or muscle. And these are very helpful in vaginismus or lax vagina. And if there is vaginismus, you can use Kegel's meter, or you can use gradual dilator or finger dilatation. And some hormone therapy may be required, lots of lubricants, and maybe if there is infection, some antibiotic treatment. The key is that sexual activity has to be. And for this, you need a good partner, you need consistent activity, and you need absence of vascular diseases like blood pressure. Is masturbation normal? Yes. 4 times a week in adolescence, 2 times a week in adulthood, abnormal when this is the only type of activity. And you need to reassure these girls because they feel very guilty after, and the boys, that this is not guilty, but it should not be obsessive. So a little bit of the treatment for sexual dysfunction will depend on what is wrong. So some medicine, some therapies, some operations, and you combine all of them. In the male, also you'll have a lot of it. So about males have erectile dysfunction, premature ejaculation, lack of sexuals, homosexual orientation, aversion disorders. And in female, it's vaginal constriction, vaginal aversion, sexual aversion, desire disorders, and lesbian orientation is very, very less in female. And then the couple may have a factor like the marital discord, which is in about 12% of the. So there is a role of general practitioners who sees these couples every day. There is a role of psychiatrist. There is a big role of a gynecologist and an andrologist who can give them a complete examination. There is a role or no role actually of any alternative medicine or roadside sex in increasing, power increasing, Japanese oil, things like that which come there. The friendly homeopath might give you some sweet tablets, but the bullet 3 and not 3 or Japani tail, etc. should not be tried, and these could be harmful. There is a role of hypnosis if there is unconsummated marriages due to sexual dysfunction, just to find out the reason. There is no role of any religious priest to drive away evil spirits, which is usually happening to these, and these people land up with people like this. There is a role of narcoanalysis again in unconsummated marriages or severe sex. And there is a big role of counselors who need to explain to them all the phases, or need to explain to the couple how it is. And there is a big role of child sex education on all these phases. And to answer the question, where did I come from? So, ladies and gentlemen, to summarize, the stages of sexual activities are basically 4: desire, excitement, orgasm, resolution. And there are some questions which should be asked, especially and explained, especially about foreplay, especially about the sexual pills which they take, the blue pill or the sildenafil or the tadalafil, especially about positioning in sex. And it is important for all to understand the phases of human sexual cycle and address sexual issues and encourage discussions on them by the doctor or the counselor, keeping a non-judgmental attitude. The take-home message is that sex is a part of our life and enjoyment, and it has to be followed or it has to be understood. So great meeting to discuss these hidden truths. And thank you very, very much for inviting me here. I am Dr. Narendra Malhotra, a gynecologist from Rainbow Hospital at Agra. Thank you very much once again for inviting me to share my views on the phases of female sexual cycle and their problems.